Okay, I think people are still drifting in, but it is 3:15, so I think maybe we can get started. So this is the last session of this really interesting workshop, and of course that means for my fellow panelists that we have a responsibility to be especially interesting and energizing to keep everyone awake and interested. Our session is also on preparedness, which we started investigating in the previous session. But the focus here shifts a little bit away from private sector engagement, more towards public institutions and government's role in preparedness, and also with a specific special lens, and that's the lens of incentives. It's something which has been coming up all throughout our discussions. It's a very powerful lens because it really focuses on the motivations facing all of the agents who are relevant in the pandemic disease context, all the way from the individual woman or man on the street who has to make a decision how to change his or her behavior when facing a pandemic threat. Those changes in behavior could have a massive impact on the propagation of the pandemic, either by slowing it down or by speeding it up. And really what's interesting about the incentive lens is that it then focuses the question on what can you do to change those incentives, and that's quite a productive set of questions to be asking. I think you can look at major international institutions, World Bank, WHO. What are the incentives that are facing them in terms of where they allocate their resources, whether towards public health agenda or towards the whole range of other issues that they face, or the incentives facing government. We've already talked about the choice facing government about whether to pull the trigger and declare an emergency or to stay quiet. That's a critical choice. How might those incentives be changed? Or the incentives facing donors. I think that's a crucial one. We see this pattern where the flow of funds on pandemic financing tends to follow huge spikes, which essentially occur after the event and then tend to sort of tail off and go away. How do we change those incentives? Those are probably essentially political incentives. I think we had a very interesting discussion this morning about how politicians will always find it more interesting if you can give them a picture of the child whose life you've just saved, rather than investing in public health systems, which is a much more abstract entity whose effects are much more indirect. How do we handle those incentive questions? We have a very distinguished panel to help us discuss these issues. Immediately to my right is George Gao, who's Deputy Director of the China CDC. Next to him is Hans Tødesen, Assistant Director General for Director General for General Management at the WHO. And to his right, Richard Gregory, who is Senior Policy Advisor for Global Health Security for DfID. We have a fourth panelist who is David Navarro, Secretary General Special Envoy for Ebola at the UN, who can't be with us here physically, but who has taped answers to some questions. So let me maybe start at the other end with Richard. In 2013, DfID issued a report on the economics of resilience. It's a very important topic, very broad topic. That report focused on the need for greater investment in preparedness. Could you maybe tell us a bit more about how you think about the cost effectiveness and value for money of investing in preparedness that you discovered through your researches?
Yes, thank you, and absolutely. And should start by saying that this report was very much focused in the humanitarian sphere rather than the health sphere, but it's something that maybe throws up some interesting lessons and reflections. So I'll answer the question by first describing what the report looked at, and then some of the key findings, and then finally some possible implications for us looking at pandemic risk. So the report that you've referred to was something called the Economics of Early Resilience and Response, or TEAR, and it was a UK-commissioned independent study. And the idea was that it would test the hypothesis that by investing in early response and or building resilience of communities, to cope with risks and disasters, it would result in a more cost-effective response than just your traditional late humanitarian response models. And the way that the study went about this was case study driven across 5 countries: Kenya, Ethiopia, Bangladesh, Mozambique, and Niger. And it modeled droughts, and it looked at different severities of droughts over a different time period and modeled those out. And in the modeling, it took 3 scenarios for each of the countries, storyline-based scenarios. And storyline A was that you had a late response purely on the humanitarian side. Storyline B was that you had an early warning mechanism that kicked in with an early humanitarian response. And storyline C was that there'd been prior investment in the resilience of communities. And what was interesting as it modeled out was findings in 2 main areas. The first was looking at the cost of the response and comparing early versus late. And it found that across the different countries and the different scenarios modeled out, on average, an early response cost 40% of a late response. And the range on that on the different scenarios was between 7% and 71%. So an early response was much cheaper than a late response. And then the second bit of the study for each of the case studies looked at the investments in resilience and looked at the benefit-cost ratio of having made those investments in resilience in terms of what your costs of response further along would be, and modeled that out over a lengthy period, over 20 years. And it found that across the different countries, although there was a caveat that the scenarios weren't directly comparable across countries, the results were positive benefit-cost ratios between 2.3 to 1 and 13.2 to 1 over those 20 years. So highly cost-effective to invest it in resilience. So in terms of what it meant for the humanitarian sphere, and there were 3 main lessons for this. One was respond early, because it's more cost-effective. And there isn't actually really an additional response an additional cost per response of an early response. The second was that worries about the false early response don't really add up, because these results say that you can afford between 2 and 6 responses going in early before you get to the cost of 1 late response. So there's a really strong case of responding early against that counter-argument that maybe you might be responding unnecessarily some of the time. And the third main finding is that we should, and it's almost a no-brainer, we should prioritize resilience investments alongside that better and faster humanitarian response. And this was backed up by another study that DfID did, or was involved in, looking at actual DfID responses in 3 countries and looking at preparedness as a part of resilience, and found that preparedness investments had a return on investment between 2 to 1 and 7 to 1. And they also had, in addition to that, a time saving in the response between 1 week, well, it was 1 week faster on average. So again, if we start thinking across to the lessons of pandemics, preparedness, if we can say this, and there's the caveat that this isn't pandemic research, but if we get the same findings, clearly really important that not only are you more cost effective in your response, but you're able to mobilize sooner. So moving on, what does this mean for pandemic financing? The first thing to say is that there is a caveat in that this was based around drought risk primarily rather than pandemic risk. So I think it reinforces to me some of the conversations that we had yesterday about needing to really explicitly set out the characteristics of pandemic risk relative to other risks that we're more familiar with dealing with, and working through some of the modelling. Second lesson is that early response and investments in resilience are likely to be more cost-effective than late response. And again, it's almost a no-brainer. And we'd expect it to almost be more true for pandemics. But I've not seen that analysis done anywhere, so I think, again, it's a call for really setting out that analysis and the modelling in the same way so we can be very explicit about it. The third is, again, picking up on something we touched on yesterday about it really making the case for triggering early and mobilising funds quickly as how you go about the response. And when we start talking about the instruments, and that is clearly part of the rationale for the sort of instruments we've been talking about the last couple of days, and it really highlights the need for that technical work on the feasibility, the parameters, and the value for money so that you can get the instruments in place to meet those requirements. And then I think finally there's a fourth point, which is about making the link across the preparedness side of things and the response side of things, and how we see the links for what we're doing on pandemic financing and response to really joining in on health system strengthening on the one hand and the humanitarian architecture and rapid response on the other, and seeing where pandemic financing might be the place to sort of weave that tail together.
Thank you. Just a follow-up question. In situations like Ebola, donors are often responding very generously, but the challenge still remains on how to link that to how to link the humanitarian response to the broader development agenda. And I think it was a point you were touching on already. Now that the Ebola response is mostly shifted to the rebuilding phase, can you describe what you think would be the most effective strategy to reduce pandemic moving forward?
Sure, and I think the way I'm going to approach this quite broadly rather than focusing on just on rebuilding, and I'm going to focus it in terms of a conversation around global health security. And I think just in terms of some of the framing, the last couple of days we've spoken very much about preparedness on the one hand, response on the other, and the links between them. I think also the framing that the global health security agenda is discussing and working through around prevent, detect, and respond is a really helpful framework for thinking about this. We would probably like to add prepare and predict into that mix. But also in the way that we're actually talking about this in our own UK government's thinking around global health security is coming out in, forgive it sounding like a soundbite, almost making it sound like the world needs a set of superheroes here, but it's how we can be stronger, smarter, and swifter. And so what I'm going to say is take us through what we see as the building blocks for global health security and reducing pandemic risk. So under that stronger heading, two main areas, looking at strength of the international architecture and strength of country health systems. So there's clearly a huge amount of work for preparing and improving and making the world more ready and equipped to deal with pandemic threats around strengthening WHO and the rest of the international architecture, working with them to help strengthen and picking up on the findings of the stocking reports, the work that the high-level panel's doing, and engaging with that. There's also the specific technical frameworks in terms of preparing for pandemics of taking the international health regulations and looking at how they can be implemented at country level. And so that's sort of the next big piece on what we're thinking of as stronger, which is around in-country capacity. And seeing that around implementation of the IHR, understanding what bits of the health system that links into, because we're not convinced that just taking the IHR on their own is going to do the job for us. It's got to be a case of look at the health system in its totality and then which bits of the health system most need strengthening so that you've got the preparedness and the capability to detect and respond and have those core capacities in place. So whether that's surveillance systems, whether it's human resources for health, building up those whole systems. On the smarter piece, that's partly around surveillance data and linking into that country capacity and being smart about getting the data we need, responding to it quickly. But then also two really important pieces of work, or two really important areas. One around new technologies, so particularly drugs, vaccines and diagnostics. And then the second being around protecting existing technologies. So we'd see work on antimicrobial resistance as really pulling into the space on pandemic preparedness and the broader global health security piece. Finally, swifter, and I think that's the bit that is probably of most interest given the conversation we've had the past couple of days. One of those being around rapid response arrangements in terms of getting the right public health specialists, getting the epidemiologists out, and then in due course having the health workers out. And so really supporting the work to establish the global health emergency workforce. There's also been some work on how the UK contributes to that and has our own rapid response force that our Prime Minister announced at the G7 earlier this year. And then the second bit of it being the whole package of emergency response financing and everything we've been talking about the last couple of days. And the way we're seeing that is wanting to really look across the spectrum of needs from health systems at the one end right the way through to accelerated emergency response at the other, and see that we've got the right financing arrangements in place and that there's enough money in the system and that the financing arrangements are complementary and not competitive. So the conversation that we had yesterday, looking across the IMF facility, looking across the WHO contingency fund, and looking at what the bank are proposing with the PEF, that's a really good conversation from our perspective, to be seeing how those different modalities can come together and what they're going to offer so we get the money where it's needed quickly.